Good afternoon, and thank you for joining us for our daily briefing. It brings me great pain to announce that we have had 3 more deaths in Illinois associated with COVID-19. One was a Will County resident in his 50s, a second, a Cook County resident in her 80s, and a third is a Florida resident who was visiting Sangamon County. My heart goes out to the family and the friends of these patients, and I feel like I can speak for all of Illinois when I say we offer them our collective strength at this time. May their memories be for a blessing. These moments will not get easier, nor should they. We are fighting this fight for every person in Illinois. We have all lost something today. Today, in addition to our Public Health Director, Dr. Ngozi Ezike, there are 2 new faces standing with me, Rob Carr, the President and CEO of the Illinois Retail Merchants Association, and Paula Basta, the Director of our Illinois Department on Aging. Ms. Basta is here because this virus can be very dangerous for older people, and it's my priority to ensure elderly Illinoisans feel as safe and secure as possible as we work together to respond to this crisis and to flatten the curve. I've asked her to speak to our seniors about how they can take care of themselves during this time. Our social distancing efforts are the most important thing that we can do to protect our seniors and to support our healthcare workers. But there are some essential things that everyone has to go out for. And while we encourage all our residents to help out their elderly relatives and neighbors, we also want to make sure that our seniors aren't afraid to go out and to get the food and medicine that they need. With the help of the Illinois Retail Merchants Association, my staff and I convened grocery stores from across the state to identify and address the fears our more vulnerable populations might have about getting the supplies that they need. I'm proud to announce that the store owners across the state have been more than willing to offer special hours specifically for senior shoppers to come in and get their groceries without other shoppers present, so we can minimize risks to our seniors. This dedicated period will also feature heightened social distancing measures. That includes stores like Whole Foods and Shop and Save here in Chicago, Hy-Vee and Valley Produce throughout Illinois, among many, many others. And you should contact your local store to find out what the hours are that they have reserved. Rob Carr from the Illinois Retail Merchants Association will be talking more about this initiative and how we're bringing it to as many stores as possible across the state of Illinois. We want our seniors to know that we're taking special care to keep them safe and to do everything that we can to help them through this very challenging time. We're also working hard to ensure that all our residents are able to get as many of the healthcare services that they need, even from the safety of their own homes. So today I'm signing an executive order significantly expanding telemedicine for both Medicaid and those who are private insured. This order will allow more providers to get reimbursed for these services and allow patients more flexibility and safety in getting the medical guidance and care that they need. I also have a special request to doctors who may be listening. I want to make sure that every provider in this state is operating with the latest health information and best practices regarding COVID-19 and other emergency public health responses. Here in Illinois, our emergency notification tool is called Siren. If you're a doctor, take it upon yourself to sign up for our emergency notification tool, sending your name and email to dph.siren.illinois.gov. Again, that's dph.siren@illinois.gov. Or you can go to the website for Siren, which is siren.illinois.gov. Every doctor in the state should do this now. Our small businesses are already hurting, and the root of that pain isn't going to go away anytime soon. I'm pleased to announce, however, today that my administration is offering relief to more than 20,000 small and medium-sized bars and restaurants all across Illinois by allowing a 2-month delay in sales tax payments to the state and to local jurisdictions. And we're waiving late filing fees and interest starting tomorrow, Friday, March 20th. Second, as of today, Illinois' small businesses from every county in Illinois are now eligible to apply for low-interest coronavirus disaster assistance loans of up to $2 million. I want to thank our federal officials, especially Senator Durbin and Senator Duckworth, for helping to push this through the Congress for us. For all Illinois small businesses, if you want to apply for these low-interest loans, you can find more information at disasterloan.sba.gov. Moving on to discuss our increasing number of COVID-19 cases in Illinois. As Dr. Ezike will announce in just a few moments, our total case count continues to grow exponentially. Understand that our reports of case count will not abate soon. For now, this is because we're doing more testing in Illinois. As of yesterday, we were able to do more than 1,000 tests statewide, and in just a few days, we'll be increasing that to more than 2,000 tests per day. These tests are only discovering people who already have the virus. I know people are looking at other countries and even cities and jurisdictions around the United States and seeing the numbers rise significantly everywhere. But as we take action, we're initiating a process that is intended to bend the curve. Earlier this week, I activated the first members of the Illinois National Guard missioned to join the fight against COVID-19. In total, the Guard is a force of really extraordinary citizens, but they would call themselves ordinary citizens, but they're 13,000 strong, committed to amazing work, and they bring to our preparations key capabilities in logistics, in transportation, and even medical specialties. In the short term, the Guard will be working to support our efforts to set up mobile testing units, allowing us to expand testing while ensuring that those tests can be administered in the safest possible way. The Guard is also doing critical work planning for the weeks and months ahead, including expanding our healthcare capacity by potentially refitting and reopening previously closed hospitals. We have to mitigate the spread of COVID-19. We have to slow the number of new cases and ensure our hospitals and our healthcare workers have the capacity and the resources to treat those who are sick. We have to flatten the curve. My team and I are working day and night, closely considering every option on the table to do this. We've seen measures adopted in other countries, as well as places in the United States, like San Francisco, and we're looking at every aspect of those steps to understand how best to keep Illinoisans safe. As always, we will share more with you as we know it, but I want to address some of the rumors that have been running around. Essential services will not close. Interstates, highways, and bridges will stay open. Grocery stores, pharmacies, gas stations, these sources of fundamental supplies will continue to operate. There is no need to run out and hoard food, gas, or medicine. Buy what you need within reason. There is enough to go around as long as people do not hoard. We will never shut these services down. And please, let's all remember that these essential institutions don't run on their own. The cashiers, the gas station attendants, the truckers, the pharmacists, the delivery workers, the sanitation workers, these are all people who keep our state on track. So please take every opportunity that you can to demonstrate your gratitude to them. Perhaps most importantly, there are some true heroes among us in this crisis. Our doctors, our registered nurses, our nurse practitioners, our hospital workers, our healthcare center operators, and our first responders. These are people who leave their families every day and expose themselves to the risks of COVID-19 by treating patients, more and more of whom are presenting with symptoms. Our healthcare workers and our first responders are the very best among us, and they deserve all the acts of kindness that we can muster. So, your friend, the doctor, your neighbor, the nurse, see if they could use a helping hand. I promise you that it will mean more to them than you could ever know.